being recorded, but we're not officially.
Okay.
Just whatever you say, just know it's recorded. Okay, calming down. And yes, I'd love a map.
Oh, they're
right
here.
here.
They're already here. Thank you. Okay, remind me, what goes inside? Little white.
Yeah, you have it right now, right? No, the other way, the other way. Yep.
What's her guy's name again?
I'm Andy.
Mandy?
Andy.
Andy. I'm Korean.
Nice to meet you.
Nice to meet you. When? Did I meet you before? When?
Oh, that's
Right there.
cute. Oh my God, that's so nice.
I can't remember.
That's so creative.
Again. Even case, right?
Used to see the Christmas tree made out of paper plates around the corner. After we finished, we're so creative.
We got
I love it. I love it.
Yeah, you got time.
I love it. I love it.
And icicles, look at icicles. Turn right.
That is so
I mean, your
cool.
left.
Oh, that is so
Oh.
Ah, that cute.
This is
Yeah.
so nice.
I know. Look at the paper.
Nice.
I love it.
You see the paper plates, though.
Oh, I
Paper
can
plate
see
tree.
it.
So the kids did that. They
Yeah,
made that.
I'm sure. With the assistance of their wonderful teachers over there.
Oh, that is so cute.
Ah,
Finally got the 501c3 approved. Yeah, I got certified.
you got certified.
Finally.
So you got the funding requested and everything?
I gotta do that.
Not too awesome.
I had the for-profit already RFSQ. It was already done,
Yeah.
but it wasn't done through LASA. I found out it was through DMH
Oh, what do you
and
call
DHS.
Do both.
I'm gonna do that also.
Because I'm on that task force for the
Uh-huh.
PMRT stuff. But we gotta do something. Oh, look how festive we look today.
You should do.
I know
With
I
our-
should have threw
all
my
our
set of
masks.
shirts.
All of our masks, very festive.
Oh, yeah. I should have put a Santa face right here.
Those are the decor colors.
Yeah.
I saw a meme
These
on
are-
Facebook. It was like 2020. Everyone's celebrating Christmas Eve on wearing gowns and masks and everything. Like, all the
Remind
stuff.
you of the past 4
Safety.
years.
Yeah, so we've come a long way with just just.
Don't look like it, like, look down.
Yeah. So,
Well, there's a lot of things going on in this world right now.
Yes.
Regarding homelessness. I wish I would have made it on that memorial. They had a 3 o'clock memorial Zoom today.
Oh,
And I didn't get off my other Zoom until 3:40 or so. So I'm like, wow.
What was the memorial for? Is
For all the
what
homeless land that died on the street.
really?
They was saying that they wanted suggestions on how to resolve it, get them off the street. That's my suggestion.
No, was this like was this like a large number of homeless people dying at the same time on the street, or just like over the time?
Oh well, over time,
Over
and
time.
simultaneously, anytime winter comes, and you know,
Uh-huh.
we have more deaths. There's some, that's died local. Right on the corners. I should have had one of the girls on the newspaper go in my place because she wrote an article about one of the guys that passed on 54th, right in front of the EDD building.
Oh, no.
And so it's just happening a lot. But some are natural causes and some aren't.
right.
So
So there seemingly is an issue going on in Harvard Heights or West Adams Heights, where half may have been given some apartments in a non-PATH building.
what? How's
Yeah.
that possible?
I don't know, but they seem to have placed people in a building that Chantel lives in.
Really?
Yeah, Chantel being the person who did a presentation for an environmental committee,
Okay.
a renter, but
Okay.
she's been one of the advocates for non-smoking apartment buildings.
Mhm.
So we already know her.
Okay.
So I'm So I've been copied on a bunch of emails, but apparently PATH has placed
That's
people in the building and they're
They made some kind of deal.
smoking dope. They're
Oh,
tearing down the no smoking
no.
signs. This one guy has put his
Oh.
own personal lock on the front gate.
No
I
way.
mean, stuff is happening.
What building is this?
I'm
We need to
unclear.
find out.
So is Pat not
they-
providing monitoring services or?
Yeah, I mean,
some
that's,
sort
to
of-
me, it would seem
But
that
if
if you're
it's not
taking
PATH,
people
yeah.
off the street, is it 7 o'clock yet? That you would need to be providing services, especially if you're
Yeah, it's supposed to
doing
be wraparound services.
merged kind of thing. So I don't know the whole story. I left a message for Danielle because she was copying on that.
Is it co-ed, like mixed?
That's an apartment.
Yeah, so that's the apartment.
Yeah, there's a number of large apartment buildings.
7
Okay, it's
o'clock.
7 o'clock. So even though I'm yakking and gossiping, you can call the
That's
meeting
okay.
to order.
We're gonna call the meeting to order, 7 o'clock PM. I'm Tori Bailey with the UNNC Homelessness Liaison, here for another exciting topic of homelessness, informationals, good and bad news,
Laura,
some still pending.
your computer is in front of the camera's view, and you can't see.
Well,
There we go.
oh, well,
Yeah, there's
It's
not much
on a
I can do
signature
there.
hat.
There we go. Much better. See now it's.
oh, there you go.
Oh, I see it.
There you
It's just a
go.
little bit on.
Well, hopefully they heard that I'm trying to get over an allergic reaction, so voice is not 100%, but hopefully the listening audience is able to hear the words that we will speak on this evening regarding homelessness. There was a wonderful homelessness memorial today at 3 o'clock, and we'll talk about that a little more in public comment or in the near future. But right now,
Welcome.
well, I welcome everyone at 7 o'clock. But yeah.
The agenda.
No, I'm telling you, my eyes are still hazy from the allergic reaction. But yeah, well, I did welcome the call to order at 7 sharp. And so we have some interesting presentations today. We will talk about the homeless count because the homeless count date falls on our regular meeting date. So we may have to, I don't know, meet the week before.
Yeah.
People will be calling and registering. And we hope, I'll say this several times throughout the meeting, but go to theycountwillyou.org. Register for the Homeless Count 2024, January 25th at 6:30 p.m. is when we're gonna gather. Put zip code 90018.
We will get to it. I've got
Yeah,
it, I've got it sitting
Keep going.
Oh,
Yeah.
ready to go.
We're gonna announce that other times throughout the meeting.
Okay,
Okay. Hi, Donna.
so I'm gonna
Hi.
stop share.
Hi,
How you doing? There's Muriel. I have
morning.
Yes. We're recording, of course, already. My voice is a little faint. But Muriel and the committee and Kareem, we're gonna share some information today. And I was unable to send out the agenda like I normally do, but the good thing is it's on YouTube and the information will still be disseminated. So that's the main thing, that we have that exposure. So Laura had a technical, she's doing year end, so everybody's multitasking today. So any public comments while we at it, any 2 minute, anything update? Donna? Who, I can't see who else got, Muriel?
That's it.
Okay. Yeah, see, I didn't get a chance to invite anybody. Y'all should have sent it out to me. You have to remind everybody, especially during this time of year.
Okay.
But I can tell you something. Oh, it's public comment.
General comment, public. comment.
General public comment. There, the homeless liaison found a homeless man sleeping on the church ground apparently been there for some months because he built a house with a little door. Go figure. I can't even laugh about it. But apparently he's been there for a while. But we had a big activity on Saturday, and that's how we were able to find him. So my thing is, I believe the gardener had to know because he's supposed to be cutting the bushes, right? And had he cut the bushes, he would have hit the door. So that's just my thinking. I did call the mayor's circle team out. This was the shortest I ever waited on hold, and they came right away. The dilemma is, they said that he told them no, he didn't want to go anywhere. But see, I asked him in Spanish, and he said yes. But he hadn't finished cleaning out all his stuff, and they was ready to go at that moment. So it's like, needless to say, they left him, but they were supposed to come back get him. So I will check it out in the next couple of days to see if he's still there. So that's where we are at this point. And if I have to call him back, or when I get back on the task force meeting again, we're gonna talk about this. Because if he told me yes, when I asked him in Spanish, got his name, got his date of birth, got everything that was necessary for them to take him. So they should have taken him, at least enrolled him in a winter shelter. Because there's no reason for anybody to be on the street right now with the winter shelters open.
Right.
Yeah. So any public comment? What's happening with you, Andy? Regarding housing.
Well, finally, my nonprofit was approved for as a 501c3, so we're officially certified. That's a big milestone.
That's a big milestone.
Yep.
He's working on a big project where he's gonna have a lot of housing available.
So the next, my family and I, we are closing on a property where we'll be opening up an approximate 50 beds for the homeless senior population with disabilities in the area of Long Beach, San Pedro, and even parts of like Gardena or the South Bay pretty much.
And maybe Culver City?
South Bay, so
okay.
It encompasses areas like Culver City, Santa Monica.
That's exciting.
And parts of LA as well.
Oh.
So that's the big news there is that we're expecting to close escrow on January 8th of next year. So everything will be happening with the new year.
That'll be exciting.
Yep, very excited for that.
It was, everything gets caught up in a quagmire. His funding situation, and he thought he did all his paperwork. Everything was done. But, you have to be a part of a collaborative most of the time to get that funding taken care of. So he started coming to task force meetings, and then he was able to unlock that stagnation. And now he's about to close on the 8th. That's good. And the nonprofit's been approved.
Well, so I just want to add this. The purchase that we're doing right now, this is my family's own money that we're using.
Oh,
this is not part of any grants or anything like that. Okay. It's just an initiative my family takes to help the homeless population, especially the elderly homeless population with disabilities in the community, to house them and provide them with boarding care services.
Okay. That's good. That's 24/7 care?
That's 24/7 care with meals, food, a warm bed, sleep in, everything that you would see in a boarding care facility.
Right. So does this fall under the umbrella of LARCA?
It does fall under the umbrella of LARCA.
Okay.
And tell us what
LARCA stands for.
So I'm the elected board of director for LARCA.
What does LARCA?
I'm the elected board of director for LARCA. LARCA stands for Licensed Adult Residential Care Association. It was organized for the facility owners and operators in LA County, but also we provide resources to outside facilities in California. However, we do specialize majority in LA County. We have over 450 facility operators or owners in LA County who are members of LARCA. And that number is growing significantly as LARCA becomes more and more popular in the community because of the services we offer to all of our members. And again, these services are free to all the members. You can join LARCA and become a member completely free of charge. The services you get are representation in the state of Sacramento. We were just there. We had a big initiative that Tori was also a part of. We did lobbying in Sacramento at the Swing with over 31 elected officials to actually create awareness for facility operators in LA County who aren't being compensated enough to continue to house and also provide services such as meals, care, medication records, medication administering, and all of that to the homeless residents. So that was one of our biggest initiatives that we really took a lot of pride in, because not only did we get the 31 elected officials' attention, but we also were able to get action from these some of the most popular elected officials in our district in LA County. So a very big initiative that I was a part of, and I was so happy to be a part of that.
Yeah, that was exciting. One of them called me last week, and my suggestion, we have interim housing.
Yeah.
And that's about 120 a night.
Mm-hmm.
The people that's been there, this is just my opinion. I think they should only stay in interim housing 8 months to a year or so. Pretty much who has the capacity to live on their own and who don't. And some of those could be transferred over to the assisted living, and the money that's spent there at the hotel, the difference could be sent to assisted living with the client instead of just, leaving them at the hotel without any guidance. We'll see. But anyway, who's that?
I don't know.
Okay. Okay. Well, anyway, any more public comment? Dr. Parker? Any public comment? What's your feeling from a landlord perspective?
I think she doesn't have a comment.
Yes, she does. She always got something to say. Here's her chance.
Well, this is my first meeting, and I'm very glad to be here to see exactly what is happening in the community and in the county. And congratulations to you for doing such a big tree at this time. And I would like to listen and know more about what is happening in the community.
Right. She pretty much has the same concerns as many of the other landlords has been on periodically, and that's that the agencies should have more supportive, hands-on, if anything goes wrong as far as destruction and violence. There should be some more support, some wraparound services, in addition to just leaving it all on the onus of the landlord. And then the table, what's that chart you guys go by? How you get reimbursed, the cost of living, etc. That needs to be reevaluated, looked at, and enforced. So there's a lot of things that people should start coming together and having different groups of task force meetings to enhance all these actions, because either you want to come in or you don't. So that's another way I look at it. They should ask every person that's on the street, would you like a place to live? If the answer is no, we're gonna build you some plexiglass houses out of Lancaster somewhere, make it feel like you outside. But there's got to be some kind of process of elimination to help those who really want to be helped.
Mm-hmm.
Okay, so next, Laura.
Okay, so do you want to move on to your presentation?
Yes, please.
Should I re-share the screen with the agenda?
Sure. And who's
That's me.
the caller user?
Yeah. No. Oh, I don't know who that is.
Oh, okay.
Saying the bing bing is me. We could
Oh,
ask.
I know that's you.
Yeah.
With my eye.
Okay, so your next item is Homeless Liaison Committee members' presentations on various topics. Since y'all didn't respond when I said, what's the topic? Sorry.
Oh my goodness.
Sorry,
I
I did my homework.
She did her homework.
Sorry.
So, Duriel,
So I'm gonna,
Yes.
anything that you gotta share on the screen?
Yeah, I can do that right now.
well, but I mean,
Wait, let's let.
can you, hang on. Muriel, will you be doing share screen? Because I need to make you a co-host, if you are.
I would love. Yes, please do make me a co-host.
Thank you.
Okay, but Korea's gonna do her portion first, okay?
Yes, for sure. And apologies for not replying, Laura. I got your email midday Monday, and I think you had said you wanted to reply by Monday morning. So I realized I was late.
Oh, yeah. It's been one of those weeks, I tell you.
Yes, sir.
We gotta work on that next year. We gotta have all topics ready. Okay.
Okay, well,
You know
thank
you
you
gotta
for the
project.
platform. Okay, I'm gonna share in terms of, because it's winter time and,
Introduce yourself.
oh, I'm Karine Alpridge. And I'm with the UNNC and I'm part of the homeless committee. So I'm gonna share a little bit in terms of the 211, our information hotline that we have in LA County. And how are they helping us in terms of during this winter time? So for any individual who they find themselves, they're homeless and they need some assistance with just a temporary shelter. They are offering their services right now for individuals with no children to actually call 211. And they need to provide an email or a phone number where they could be text a link. And it's a self-referral and which they will enroll and they will be placed on a waiting list for either a winter shelter location or a motel voucher. So it's a waiting list. And basically too, what they would be also provided is information on how to be part of a coordinated services entry system where they have different programs and projects, such as, participating in various projects. And in our particular area, one of the centers that's participating is Weingarten Center. And they are in charge of coordinating depending on the eligibility, depending on the need of the individual. They could be provided into projects like tiny homes or Project Room Key, just to name a few projects where they could be given some programs where they could be assisted. But in terms of winter shelters, it is in terms of availability. It is first come, first serve. They will be placed on the list, but as availability happens, they will be text. And their role is to actually call in to the number that will be provided via text. And they will be given the information if they are eligible for winter shelter or a motel voucher. So one of the things that I did ask was, well, how long of a stay they could stay in one of these two facilities. They say it could be anywhere from 1 day to 7 days, but it could be extended depending on the weather. So if there's like a tremendous storm coming, they could extend those days so they don't be out on the street in the elements. They did say that if there are families that are homeless or with children, they have to call 211 directly, and they will be provided with assistance in terms of various programs where they could be assisted. They do have to personally call. In terms of military veterans, there are plenty of programs for them, and they too are to call in to 211. So I did ask whether or not the winter shelters, are they full right now? 211 could not provide that information, but if they did say it's depending on availability. So that's what's happening right now in terms of resources in LA County.
Ah, she did her homework.
Exactly.
But I'm gonna have to tell you, winter shelters are until March 31st, 2024.
Yes.
You have your bed unless you miss 3 days. If you miss 3 days, your bed may become available again. So they're very careful not to do that. And you have to be, well, different shelters are doing different little things, little nuances, but all the winter shelters right now are until March 31st. Now that 1 to 7 days probably alludes to the hotel vouchers. Yeah, so I don't know how that's going. But I have a weird new phone, y'all, and I don't know. I don't even see who's calling. But anyway, so the winter shelter, there's no excuse. Anybody, if you see somebody on the street, all you have to do is Google winter shelters. You can give them the closest address with the telephone number they call right there on the spot and see if there's a bed available. So
They did say right here that the winter shelters provide temporary emergency shelters for adults 18 years and older, to be away from extremely cold or wet weather conditions. Shelters provide a cot and a blanket for sleeping purposes.
right,
They do have bathing facilities,
yes.
which are provided, and shelters will operate 24 hours per day. They are not to go to the shelter, they have to go through the 211 referral process. That's what they're emphasizing.
Okay. That may be the route they want them to take, but
Yeah.
some people that are more savvy would know to just Google winter shelters and call
That's
some of them
true.
direct. But that either way, there's no excuse right now to be outside in that rain.
That's right.
And it is raining. So we have a good batch of about 55, 60 men home right now. And they all pretty good. So far, so good. And they are appreciative. And some of them got up and got a job since they've been in there. And so a lot of people donated suits and stuff for them to go to work. And what else? Some good news all the way around. A couple of them only been homeless like 2-3 weeks for whatever reason. But it is what it is at this moment. And so I'm just grateful that they are a good batch of guys and they follow direction.
Yeah.
That's all I can say. So thank you. Let's give Kareem a hand for doing her homework.
I did. So Muriel is a co-host now.
So Marielle,
Yes. Thank you, Kareem, for doing that. Actually, that was really helpful. I know 211 is supposed to be a good helpful number, but I didn't know specifically actually all the resources they have predicting the winter. Okay, let me share my screen. So, mine, this might be a little bit more boring than Kareem's, but so for me, I think, when I think about a lot of what we talk about in these meetings and talk about issues of homelessness and issues encountered by people experiencing it, we obviously see a lot of what we see before us, and Tori gets a wide view on all this, but I think for a lot of us, including myself, I mostly see what I see on a daily basis. Who are the folks on the streets that are near me or on my commute or near my work, and so one of the things that I want to do is get a little bit of a bigger picture and get a sense of what is really the story of homelessness across California. And really try to understand as well how because that's going to be what informs a lot of the state process and the state organizations, the state funding is, they're trying to create solutions that fit for LA and San Francisco, but also for Redding and for San Bernardino and all different places. And so I found this interesting study that was released just a few months ago, that was a statewide study in California that was run by UCSF and that interviewed a number of people experiencing homelessness across the state to better understand the overall picture of homelessness in California, what leads to it and what experiences are like. So I thought I would share that with you guys here too. It's a little bit of like a statistic like vomit, but I hope that we can try to make it interesting and hopefully too it sparks conversation. So this is the study. It was called California Statewide Study of People Experiencing Homelessness. again, was done by a group at UCSF. The way that they did it, and let me actually first say, sorry, their goal was they were trying to understand um, uh, who was homeless in California, how they came to be homeless, what was that experience like, and what was preventing them from exiting. So a pretty broad goal of what they were aiming for. And so the way they did this, but did I just lose the whole slide in there? I may have. Okay. So I had a slide in there, but it basically explained how they did the study. So they went to all different parts of California. They surveyed something like 2,300 people. And then they actually, of those, had very in-depth, long conversations with close to 400 to try to really follow out all the details here. And these were from all parts of California, every county. Um, and they also really made sure that they highlighted certain groups. So if their initial surveys and interviews did not, for instance, capture people who were of certain racial minorities, who were Native American, who were trans, they actually went out and tried to identify people in those communities and interview them to make sure those voices were heard. They also recruited locally in lots of different areas these sort of advisory councils of people who had lived experience with homelessness to advise them on how to do this study. How are you going to encounter someone and ask them a bunch of questions without making them suspicious? When they don't trust the system, or how are you going to, ask people questions about things that are very sensitive about their history? So, really seems like a thoughtful approach that they took here. So the report, if you want to go, the link is here. It's like 100 and something pages. I've tried to put out the most interesting parts. But it is actually a really interesting study if you want to read the whole thing. But the first part, there's 4 parts in it. The first part was like they said, who is homeless in California? Who's experiencing homelessness? So,
Wow.
these are some of the graphs they have. So what they found, of people that are homeless, 90% are single adults. Some of them are married, but but living a single life, like on their own, not with their partner. So 90% of people are unpartnered. 7% are in families, meaning they're with minor children. 2/3 are born in California, and 90% are born in America. And I think something that they really highlighted in this study is 90% of these people became homeless while they were living in California, and 75% in the same county which they're in currently. And I think we know this, in our group here, but there's a real trope that, like, oh, people who are homeless in my community are from somewhere else. They were brought here, they were bused here, they're from another country, they're from whatever, and people use that as an excuse to not have to care about their neighbors. And first of all, these are human beings, you should care about them. But if you do really want to look at the data, it suggests that actually folks that are in our communities are our neighbors themselves. So a lot of these people don't go very far once they fall into homelessness, and a lot of them are people who were born here and lived in our community. I think the ages are interesting. The vast majority of people who are experiencing homelessness are over the age of 40. So 24% are between 40 and 50, and 37% are between 50 and 64, and 7% are over 65. So it really speaks to this older population. And I think as we're talking about building, affordable housing specifically for seniors, I mean, this is such a need. And I think you're going to see more and more data as I go through this that just underscores what a high needs population this is. These are people in particular who might have difficulty coming back to a workforce, re-education, et cetera, too. And then, for folks who are in the study too, they asked them how they identified racially. And interestingly, in the study, they asked them to sort of pick one group or multiracial, which is different than how it's grouped in other sort of settings, like in the census. But what they found here were that of people who were experiencing homelessness, 27% identified as white, 26% identified as Black, 26% as Latino, 15% as multiracial, and 3% Native American, and a number of others. And I think what's worth highlighting here is how different this is than the population in California. I think in California, something like 7% of people identify as Black in total. And so you have, 3 to 4 times the rate than in a homeless population. You have an overrepresentation also in the Native American community, where they don't make up 3% of our population. And you see it across the board. So it really, disproportionately affects people of specific identities. This is also true of gender identity, and so predominantly most people are men, although those in families, meaning those who are with minor children, are women. I actually was surprised that it was 30% of single men with young children in families too. 'Cause I think we typically have an image in our heads, or I have an image of my mind of usually women leading a family that's homeless. And then this category of TAYs, this is transition age youth. So these are individuals between, I think, 18 and 24 that they've specifically sort of popped out here to take a look at. And what they really emphasize here is actually in this population is where you actually see the largest percentage of people who are non-binary, gender non-conforming, or transgender, almost 6% of the rate of other age categories of people who also are gender minorities that are themselves falling into homelessness.
Huh.
There were some other things that I pulled out. 63% have a high school diploma. 6% are veterans across California. 39% homeless for the first time. I thought that was really interesting. For me, I don't know why I thought that number would be higher, and I think it speaks to just how chronic homelessness is. The median length of homelessness was 22 months. So of these, like almost 3,000 people they interviewed, most of them have been homeless almost 2 years. And I think that's also just a really sad thing to know. This isn't any short-term turnaround thing. The median was 22, and most of them became homeless in their early 30s.
Hmm. Wow.
Yeah.
Nuriel, let me interrupt though. What that median length of homelessness actually means is that 50% of the people who were interviewed had been
Yes.
homeless for longer than 22 months.
Right.
Because the median
Yeah.
is just right, the number right in the middle.
Right.
Yeah, exactly. So there's a whole lot of people for way longer than that, and some
Yeah.
for
Yeah.
shorter. But boy, yeah, it's
Yeah.
quite a statement.
Yes,
Sure.
it is.
The report actually punches in a little bit deeper. I didn't put in all the details here, but for people, we say 39% are homeless for the first time. So of those who are homeless for the first time, they on average are actually homeless for longer. Like the
Uh-huh.
first instance of homelessness lasts the longest, sort of what they're suggesting. Those who have been homeless multiple instances had a lower median length, meaning maybe these are people who are able at some point to be rehoused or to find something of some stability before they unfortunately fall back out again. So there's some interesting, nuances too that are in the full report.
Wow.
Okay, so the second part of the study was life experiences. So these included a lot of things. So this one is about mental health and violence experience for people, and these are importantly, this is at any point in the lifetime. This is not just during their period of homelessness. And usually, what they're really asking in these are prior to homelessness. But I think what's really amazing in this study they did, which I find so interesting, is they recognize, and I think it came from their advisory committee, you can't get diagnosed with a mental health condition unless you can see a health professional. You can't see a health professional unless you have healthcare access. You can't have healthcare access unless you have some means up most of the time. So they actually ask people themselves about symptoms they experience rather than asking if they have a diagnosis. And so what they asked here about mental health was, any mental health condition, simply asked, 82% positive.
What?
Anxiety and depression were the majority of that, almost 70%. Trouble remembering, concentrating, understanding, cognitive issues, 50%. Hallucinations, so we're talking about more significant mental health issues, about a quarter. And that's all people. In families, the rates are a little bit lower. The transitional age youth, some of the numbers are lower, some of them are higher. And the single adults in general were a little bit higher too. But I thought that this was a sort of interesting way to frame this, is that, having anything, anxiety, depression, anything, pretty much like a 4 out of 5 individuals. And the trouble remembering, concentrating, or understanding to me is really interesting too, especially when you look at these transition age youth. You're talking about 18 to 24-year-olds who are having cognitive problems. And it speaks to, either these are people who at baseline may have learning disabilities or difficulty sort of learning, or this could be from underlying mental illness itself, which is schizophrenia, et cetera, and also could relate to drug use, which we'll get to later in this as well. But even among the youngest people, trouble remembering, concentrating, understanding things, that to me really stood out. And lifetime experiences of violence, and again, that plays into it. You know, you're gonna have trouble remembering, concentrating, and understanding if you're constantly in traumatic environments. But
Right.
you know, physical violence very high, particularly among people who are gender minorities, almost 90%. And sexual violence, likewise, extremely high, again, particularly high among gender minorities. And so just the experiences that people have are completely, you know, on the far end of extreme for experiencing violence throughout their lifetime. So, you know, again, it's as we're approaching people on the street, recognizing they have so much experience with people who approach them not being nice to them that, you know, it really has to change sort of our thinking about interacting. The justice system, this was interesting, almost 80% have been incarcerated at some time. Primarily in jail, is a smaller percentage that ever been in prison. But 80%, 27% had been hospitalized at some point for a mental health issue. Almost a third, unfortunately, had attempted suicide at least once. Um, and in terms of drug use, 65% had ever used amphetamines, cocaine, or opioids, and it's mostly methamphetamines. And for those who aren't super familiar, methamphetamines are stimulants. They keep you awake, they keep you alert, but like a lot, and they keep you. They can sometimes push you into psychosis. So that percentage that we're seeing that are hallucinating, many of them are probably using things like methamphetamine. They can make you very aggressive, very agitated. And the long-term use of it can have lots of very detrimental health impacts. I thought this was really sad. 20% had had at least one overdose in their lifetime. And, you know, maybe a presentation we can do at a future time in this committee too is talking about Narcan and carrying reversal agents.
Yes.
Maybe we can have someone from the fire department come or from public health and distribute. But you know, the percentage of these folks who are at risk of overdose is so high. And for many of them too, by the way, they think they're smoking meth, but there's a little fentanyl in there and they don't know it. And
Right.
suddenly, you know, they've overdosed. Yeah.
Right.
So the ability you have to save a life is really high. So maybe that's a presentation for another time in our group.
Yeah. Yeah, I'm sure we
This speaks
talk
to
about
something we'd
that.
actually talked about it. Yeah, in a prior meeting, we talked about benefits when leaving jail or prison. Basically, no more than 20% ever said that they actually got any kind of social benefits, healthcare, or housing when they left jail or prison. And so when you say 80% of people are incarcerated, but less than 20 of them are ever then connected to the system when they leave, I mean, this is such a cycle. And to be honest, incarceration is an opportunity in some ways to get people in a place where they're in a little bit more of a controlled setting and get them those resources. I actually saw a gentleman just yesterday in the hospital, and he told me he's like trying to turn around. He's incarcerated in the hospital, and he's trying to tell me he's trying to turn around his life. But when he's incarcerated, is the only time he ever gets clean and sees a doctor. And
Mm,
so, you know, we have to give people the opportunities to do that when they're out of jail.
right.
Um, but you know, he's like, yeah, I don't have insurance when I'm not in jail. So, you know, it's a real problem that's fixable from a policy standpoint. But we gotta this to me also seems like an opportunity.
Sounds like a catch-22.
Yeah. Here's substance use again. The light green here is amphetamines. The dark green is any substance you see, just the rate of amphetamine use, particularly among the single adults. And then
Oh,
interestingly, the youngest folks, these transitional age youth, primarily using opioids. So this is a population too where really that Narcan can be helpful and can be life-saving. But man, I was really shocked to see this difference. I mean, the young people are not using meth as much, but really using a lot of fentanyl.
wow. That's dangerous.
Yeah, yeah. Here's one about that I also thought again was interesting about changes in substance use since homelessness. And this to me challenged a lot of what I thought because most people reported the same or less in many respects of drug use. Or less of drug use. You know, when they were homeless, and it might be due to the financial constraints. Um, but you know, I think there's a story out there like people are homeless, they're out there doing so much more drugs, and I don't know that this supports that idea. It seems like it's a lot more mixed. Some people are using more, maybe a little bit more people are using less. it's really among these youngest folks who become homeless and then use more drugs. And then as we're seeing combined from the prior slides that it's opiates, you start to understand why so many young people are dying of overdoses. They're using opiates, they're going to homelessness, they're using more of the opiates, and then, that can lead to overdose risk. So that's, like a kind of sad story that you can trace through this data. So part 3 of the report was the path to homelessness. How do people get homeless? I thought this was such a great question that they asked people. They asked people before you were homeless, and I'll explain what's in this graph in a minute, but they asked people before they were homeless, what was your monthly income? What was your cost of housing? How long had you been housed? And then how much warning time did you get before you lost your housing? And they separate people into what they called leaseholders and non-leaseholders. So the way that they defined it here is you're a leaseholder if your name is on something. So a rental document, a mortgage, something like that, you're the leaseholder. A non-leaseholder is like you're a roommate of somebody who's actually on the lease, or you're staying in someone's garage or something like that. So you're not on paper anywhere. And again, I think it was really bright that they split this up into two, because I think it tells two different stories. And so when you see the non-leaseholders, the typical monthly income is a lot less than $1,000 a month, but they're also paying a lot less for probably some not so great living condition, maybe $200 a month. But you also see what they call the interquartile range, meaning, if this is the median at 200, it's the 50% mark. The interquartile range gives you the 25% mark and the 75% mark. And so it tells you that actually a whole lot of these people are paying zero in the non-leaseholder realm. Most of these people that are non-leaseholders are housed for just a year. And I thought this was striking. 1 day warning before losing housing. Of course, these people fall into homelessness. What are you going to do? Whereas with leaseholders, a little bit more financially secure, making $1,400 a month on average, the housing cost being higher at $700. And again, remember, this is statewide. So LA's number is going to be way higher. But these are people who are generally pretty stably housed up to 3 years before, and then they got 10 days warning. I mean, they usually are getting a real eviction notice or something like that before needing to take off. So this also tells you two stories. When you're working with somebody who's at risk of falling out of homelessness and they don't have their name on paper, they have no legal protections, they have nothing, their risk of falling into homelessness is tremendous, and they have a lower financial safety net too. And to me, I'm also struck again, this is statewide data, not LA, but that's such a small amount, from the amount that we give for homelessness assistance and the budgets that we have in a pure cash basis. That's such a low amount. And so when we think about possible opportunities for how can we keep people housed who are right on that border, really thinking about financial assistance in a smart way, to me, seems like an obvious sort of opportunity. Again, knowing the complications that come with that. I just wanted to read this because this was included in the report. There's a few of these nice stories that I thought illustrate how this goes. And this one in particular felt to me like some of the patients that I've had. So I'll read it. I think this Carlos experienced a spinal injury when he fell off a ladder at work, unable to continue working and ineligible to receive workers' comp because he was paid in cash. He could no longer afford the rent for his apartment. As the leaseholder, he decided to vacate to avoid having an eviction on his record. He then rented a room in a 2-bedroom apartment, but left after several months due to conflict. He hoped that in moving in with his sister's family, that would be a long-term solution to his housing situation, but her family was facing COVID-related job loss and shortage of space. Didn't want to be a burden to his family, didn't have other options, so he became homeless and lived in his truck. After receiving multiple parking tickets, his truck was towed, and he's now living in an encampment near City Hall.
Wow.
And so you just sort of see the steps here, right? Here's a guy who was working, had a home, had a medical trigger for all of this, unable to work, intelligently decided to move out so he wouldn't have an eviction. Moved in with some people, that didn't work out, tried to move in with family, that didn't work, tried to move into the car, that didn't work, and is now unhoused. And so just multiple levels where, he could have been saved, or there could have been intervention, or some additional support could have helped. But now you have a gentleman with a spinal injury who's, living in an encampment near City Hall, which is just a tough situation for everybody. So I like that they highlight some of these stories. I think they tell you a little bit more of what's really happening.
They asked people the reasons that they had become homeless, and this is a longer one. I'll go into this in a little bit more depth, but really the big ticket items. Exchange work for housing, work ended, lost income, lost rental assistance, breakup between residents, social issues, health. COVID was a big one, or becoming sick in any way. And when you ask people in the categories of causes, what was most common? So light blue is economic reasons, dark blue is health reasons, and purple is social reasons. You see that social reasons are the most common reasons that people are becoming homeless, especially among the non-leaseholders. But when you get to leaseholders, people who pay rent at a higher rate or who have a mortgage, the economic reasons that actually weigh out over the social ones. But by and large, there's usually a combination of factors that are playing in. Not having enough income, not the rents are too high, plus some social issue that makes it disagreeable to live with other people or for other people to live with them.
Wow.
This is very busy, but so if you think about this is so this is kind of small. I don't know if you can see it, but this one says in this column of economic reasons, the most common was loss or reduced income, then housing costs were too high. Stolen from or victim of a scam was number 3. Now, social reasons, conflict among residents, didn't want to impose or wanted their own space, 25%. Conflict with property owner was the next one. And then in terms of health related issues, own substance use is number 1. Somebody else became sick, disabled, or died, which I find interesting as a high one. Or participant became sick or disabled as the top 3 health related issues. And then this is illnesses that people with homelessness live with. And I'll try to burn through these quickly, but by and large, it's a lot of chronic medical health conditions that anyone has. This is hypertension, high blood pressure, heart problems or strokes, your diabetes, much more rare, but 7% of people out there with a cancer. You also have 3% of people out there with HIV and AIDS. And so these are people who live with chronic health conditions that need to be managed closely by their doctors, and obviously are going to be having trouble doing that. And so, unsurprisingly, you see emergency department visits in the last 6 months, almost 40%. These are folks who are visiting the emergency rooms frequently for preventable chronic conditions, probably just get refills for their meds. This is all avoidable, right? Like you can keep people healthy with better care here. This is one that broke my heart. This is pregnancy. So, and I'll read this in a second, but of people aged 18 to 44, that they asked them whether they had been pregnant at any time. 25% of people have been pregnant while homeless, of females in the population. Among the younger folks, that was especially high at about 40%. There was a quote they included from one of the respondents. They said, "It's uncomfortable. I got to use the bathroom 2, 3 in the morning. My friend has an apartment, so I park in her parking lot. She leaves her door open. I use their bathroom and I come back out, but it's uncomfortable. My damn back hurt, and I'm just 4 months pregnant." I mean, and this is just like the tragedy of tragedies, like that anyone has to go through this just is heartbreaking. And to think that 25% of women out there have had to deal with that is really tough. And this is a population I have not encountered. I'm sure that you folks have and have, hopefully they get priority in getting rehoused, but it also sounds like in reading the report that that's not necessarily the experience people shared, that they didn't necessarily feel like it was that they got prioritized there. Health insurance, yeah.
Did they talk about the process in which they tried to get out to?
So that'll be that's actually the part 4 is like what are the things that are working and what do they find as barriers? Like I'm sure that there's individuals who are trying to use the system in their own counties, and some of them it works great and some of them it doesn't, and some of them are going about it the right way, and some have Tory and some don't. But it's still out there. Health insurance is mostly Medicaid. Up to 15 to 20% are uninsured. And then time since last visit with a healthcare provider, the majority, again, everyone's going to the emergency room every 6 months. So most have had an encounter in the last 6 months. But you still see some people where, it's been more than 5 years since they've seen a doctor.
Okay, to start answering your questions, Corey, getting back into housing. So, here are the barriers that people reported. So, question one was, how about affordability? I can't afford housing. 90% said either a little true or a lot true. And housing I can afford is far or unsafe was 57%. And I think this speaks to our piece in the beginning where people, they have their communities, their social networks, they're close to their doctors, they're close to whatever. If you offer them, hey, we have affordable housing, but it's out in Silmar, that's not necessarily going to work for them because it puts them into a completely different life, completely different network away from their family, et cetera. Or, hey, it's going to be in an unsafe neighborhood. So, for a lot of people, they're willing to compromise even when it's far unsafe. But a lot of people, the majority aren't.
No.
Prior discrimination. So 43% said that they experienced discrimination. 36 said they got discriminated against because they have a record the justice system, and 50% said that their credit history or past evictions are a problem. I thought this was an interesting question. They asked folks, okay, what would help? What would help a little? What would help a lot?
Right.
So
That's a good question.
$300 to $500 a month. Honestly, that was the thing that help a little was a lot there compared to the others, which you're going to hear in a minute. And help a lot. I mean, only 86% of people thought that would help very much, which we're going to go to the next slide. But a lot of people just see the system as such a barrier that no matter how much money you give them, they still don't believe that they would get housing. But $300 to $500 a month, versus they were also asked this question: how about a one-time lump sum? Now, everyone liked that a whole lot better. Uh, Maybe the dollar value is higher. Would have liked this question better if the dollar values were more equivalent, like an annual lump sum versus the monthly. Housing voucher, most people thought that would help. And then housing navigation also was a big winner. So this is just, again, this piece about affordable housing much further away. Here was a quote that they had from one of the respondents. No, I wouldn't move there because my doctors are here. That's a big concern for me. I have the same doctors and what's going on. They have all my records and I know them too. I know Tori and we met somebody last year who was in the middle of eye surgery. He'd gotten one done. He was getting the other one done later. And so he didn't want to move from where he was because he was like, where I'm at now, connect me to my doctors. I'm not going to try to mess with that right now. 63% said, pardon?
Plus, he was waiting on the housing development to be finished.
Yeah, right around the corner.
Yeah.
Yeah, that was another one, right? I remember, you're right. They had offered him something real far away. And he was like, no, because he also had a job around the corner, right? He was cleaning out a bar, I think. Yeah.
Exactly.
So perfect example. He's got a network, he's got a job, he's got doctors, whatever there. And yeah, he's in an alley right now, but he's got an opportunity maybe in a year to get something nearby rather than sending him off to the boonies where he doesn't know anybody. 63% reported they did not have somebody from an agency to help them. 46% said that they ever had a case manager work with them. So the majority did not reported they never had a case manager even work with them. Only 15% said that somebody was checking in with them once a month for the last 6 months. And you got to know that 15%, those are the folks that are most likely to get themselves out of the housing too. These are the people with phones and who are probably sheltered and whatever. So, we're talking about 85% of people haven't gotten even monthly check-ins. That's pretty bad. And again, there's a geographic spread here, but that's pretty bad. And then so these are the conclusions they had. You guys I think it'd be more interesting if we discussed it. The report had all these ideas of financially support living with family, give family money to house people who are marginally housed, give people cash, streamline lower barriers for IDs, because people need IDs to be able to get housing, which is something they identified that came up a lot. Expanding access to housing for pregnant people. So there was a few things that they highlighted in their report. But my big takeaways was, one, again, I think in this room I'm preaching to the choir, but folks experiencing homelessness are our neighbors, that they're not a monolith. I mean, you really have in this community of people who are on housing in California, different stories, different people, different backgrounds, different needs. And so, one size fit all solution it's just not going to work. A simple solution is not going to work for this complicated problem. Most are not experiencing homelessness for the first time. There's a lot of interaction with the criminal justice system, and everything is complex. Your mental health, drug use, and then other medical issues. And I again am struck by the income and rent prior to homelessness are relatively low. Again, relative to the magnitude of how much we fund services, and that might be a place to prevent homelessness. But what do I know? So anyway, I found it to be illuminating. Gave me a wider picture to understand what homelessness is like across the state, not just in LA, but I think it does have lessons for us here. Curious what resonated with you guys.
Wow, it was so much, but the 63%, the 63% who've never seen the case manager, where are they? Do you know?
So they didn't in this report, they didn't break out the subregions. So they had 8 subregions. LA County is itself its own one of those. My guess is they're going to keep chewing this data and release sub-reports over the next year by county. So I can't tell you what it's like locally here or where it was more across the state. But they did report that like overall sheltered homeless individuals were more likely to have interactions with these folks than unsheltered folks, which again,
Right.
matches our experience too.
Yeah, that's true. That would be true, and that would be step number 1. Maybe the outreach team can include a case manager. Like we went out with multiple disciplinarians, and so that's what they should be doing.
Yeah.
I mean, yeah. So, any questions for Nuriel? Your patient population, how are a lot of them homeless?
Yeah. So the patients that I see, it's a mix. So the patients I see in the clinic, typically not, because it's just like, to get to the clinic, it's tough, right? You got to get on transportation to get there, whatever. So it almost filters out, unfortunately, folks who are unhoused. Not on purpose, but just it's tough to keep an appointment and get there on time and bring all your
Right.
stuff, and you got to leave your stuff at the encampment. So the street medicine team mostly sees a lot of those folks. But when I'm working in the hospital, then plenty of folks who are unhoused. So I've seen at least a few within the last few days because I'm working in the hospital this week. So much more common there and in the emergency room. And then I would say the other part of my job is I work with the incarcerated population in LA County jails, and the homelessness rate among those folks is quite high.
Yeah, that's true.
I have a question.
Yep.
I actually have a couple questions. One of which really kind of bothered me because I am a landlord, where you say they were given a notice to leave one day, and I don't see.
Yeah, I don't see how that could be true.
Yeah.
I mean, in other
Oh, yeah.
Muriel, I mean, in other words, because I work with a landlord too, and I hope we never made anybody homeless. In fact, we the one time David evicted somebody, he then rented a motel room for her. We kind of got
the
it.
lady out to put up
He
my
Yeah.
just her in the apartment anymore, but it's a lot of denial on the part of the person who's getting notices, and they ignore the notices.
Oh,
And
totally.
then all of a sudden, the sheriff puts something on their door, and they count
Yeah.
that 1 day or 2 days. So
Wow.
Yeah.
but the multiple
That's
notices
right.
Yeah.
before that.
Court appearance.
Exactly. I think there's two
Yeah.
there's two important things here, I think, on that point. One is this is a survey of the people who got evicted. So it's whatever version they want
Whatever
to
they
tell.
exactly.
But the
It's-
the second one is the 1 day refers to non-leaseholders. So this might be
Right.
something like, I'm being rented an apartment. On the side, I'm subletting. My landlord
Right.
might not even know. And I get into a fight with this guy, and I tell him he has a day to get out.
Right.
Oh,
That-
Right.
that's
And or they got a notice and they didn't tell you.
wow.
Yeah. So that's
Yeah.
the non-leaseholders. These are like, you're paying your buddy $100 to sleep, under the stairs, and so that's the non-leaseholders who are reporting the 1 day turnaround. And again, the data said that there was a lot of social sort of like roommate trouble situations. The folks who are actually on a lease, you guys are interacting with, are reporting 10 days notice, which again, that's a lot less, I'm sure, that you're giving people in general. But
Right.
at least that's not the 1 day situation.
Right. But Nuriel, we also, if you ever spend time on Nextdoor, this is social media, lately there's been an awful lot of postings saying, I have to move tomorrow, can someone help me?
Oh, wow.
You know, I've got 2 dogs, I've got a cat, you know,
Oh,
can
yeah.
someone help me? But I don't know that they didn't know about it 2 months earlier,
Right.
and they just
Even
didn't
if
do
you did, if you
anything.
don't have the money.
No, but I'm saying they
You
didn't ask
cannot
for
just
the
put out
help.
anybody. You have to, there's a time frame.
Yeah.
Yeah,
They can stay and stay and stay and stay.
right.
That was gonna be my next question, L'Oreal, is that how many of those people that you know, these homeless individuals, especially the ones that are being evicted, how many of these individuals actually try to do something about it to get outside help to pay for their to help them support their rent? Because I'm sure there's programs or there are nonprofit organizations that will temporarily assist you financially to make sure you still are able to stay in that thing that you're in, the apartment building that you're in, so you're not evicted, just, you know, you're not on the street right away. Do we know how many have tried
They-
to run those
They
initiatives?
didn't, yeah. So I didn't see them ask a question like that of like, hey, where have you tried to get funding from for housing? That said, they did ask a question. I didn't include it in here, so it's in the report. They asked folks, what's your current source of income? And they
Right.
broke it down. The majority of it is in Social Security benefits, but a smaller portion is working odd jobs, panhandling, and so then there was an amount that was like nonprofit, like foundation support, and then there was friends and family sort of giving you money. But by and large, it was Social Security. The other stuff was much smaller. But I don't remember the exact numbers. But they didn't ask them like, hey, what did you do in that moment when you were about to get kicked out?
Yeah.
Right.
Well, but you have to look at your scenarios that you have. A lot of them had health issues.
Yep.
So when you have a health issue, you're not gonna feel like trying to find no money from an organization you know nothing about.
Right.
There needs to be some sort of case management
Yeah.
or some council work or social work that needs to be done
Yes.
to assist individuals.
Another question I had, well, and what I'm looking at is, what are you gonna do with the results of this survey? What's the end results of it?
Right.
Another thing that I'm kind of concerned about is that you did your demographics according to age, and you cannot treat the ages the same way.
No.
You cannot do a 14 to 17 years with 50s or something. What would be the suggestion from whoever's going to implement a program on how this is done? You need to look at it. But I really want to know, what are you going to do with this data?
Well,
Well, not him.
no. Well,
just him.
we are discussing it right now. Hopefully, we come up with some solutions that we can make suggestions to the mayor or to anyone else who will listen. But there are organizations that support TAY, which are the transitional age youth, which are the 18 to 24, sometimes 26 if they're in college. And he has the elderly, 65 and up, or 60 and up.
60 and up.
60 and up. So there's a whole arena that's untapped with his age group right there that don't have beds or need to have some of those beds.
Mm-hmm.
So there's agencies for every last one of them.
Then
The
they
problem is
they need
they
to be
don't
identified
know they
and what they do.
exist.
They need to be identified in what they do, but also for what how I would attack it is, first of all, I go by each page and recommendations,
Right.
each one of those items. What are the recommendations? Who is the agency that meets it? Or should you establish an agency to meet it? I
Yeah.
take one page at a time.
Well, we can make recommendations from it if we care to, if it doesn't already exist. But most of this already exists. The best thing that we can do probably out of all of this is come up with some way that a case manager can go to the street. You know what I mean? An outreach case manager.
Well,
And I don't think they need to be visiting the same person 5 to 10 times.
Sometimes in the shelters, they have case managers that could identify
Oh, they
if
do
they're
in
in
the
the system or
shelter.
not. Yeah.
They do in the shelters. Well, once they enter the shelter, they're gonna be in the system.
Yes.
Yeah, that's just a given.
Target people on the
That,
streets.
but
Tents.
right, but the street, the people on the street need to be referred somewhere.
Right.
They don't know a lot of these agencies exist.
And that was another thing that I said is communication. How do I know that? The 00?
How do you know what?
How do I know to call the number?
Oh, 211?
What are you doing? And I want to say you're verbally. What is being done to advertise that I'm in need and these services or some services are available? And it needs to be more than just word of mouth or what somebody going on. Why don't you public PBS, all these other services?
Right, billboards.
Billboards, all kinds of things to announce that you're out here, you need shelter, then you can do so and so and so and so. Call this number or whatever. What has been done?
So I think that something similar needs to be in place that is available right now for elderly, right? So the way I get my referrals for an elderly care facility is when an elderly becomes sick, they go to the hospital's emergency room, and then they have social workers that work with them.
Right.
If the
Yeah, but why
elderly
would
cannot
what I'm
go,
saying is, why do I need this step? If you put out there and say, you need help, contact so and so. Why do I have to take these steps?
Because every last one of them have criteria.
yeah, there is.
And so there is a
regulation.
criteria
We're
by the state regulators that they have to follow.
admission, we have admission records, we have admission reports.
Okay,
Physician report.
that's for your group, your organization.
That's for
But that's
I'm a
mostly,
homeless person. I am
Yes.
sick. I don't need to just go to and then been sent. I need to know immediately what can I do. You say call the number. I don't know how to get it.
There's nothing there
You
for
have-
that. That's where.
I don't have a phone.
Yeah.
Yeah, that's the
So,
problem.
you should be
It lacks.
Surrounded
it
with
lacks
it.
that.
Well, I used to have a little pamphlet that had every what to do for an individual, what to do for family, what.
Yep.
I gave it to Holly Mitchell's office to see if they could replicate it with the right telephone numbers on it. Because I called all those numbers and half of them were wrong. So I was like, oh my goodness. But this is what I would get from from Don, from the city.
So
And it's so helpful because all you do is hand it to them.
Okay, I
you
want
can
to
put
go
it in
back.
markets and different places where people are passing by. Homeless and not
Yeah, give them straight
homeless
to
go
the
to the same places. You
Okay.
really do.
No.
Can we go back to
You go to-
Nuriel?
Go ahead.
Okay.
Nuriel, whoever created this study, what's their intention for what they're doing with
UC San
it?
Francisco.
Yeah.
Yeah, so this was a study, they mentioned the first section that it was requested actually by the California state government, so it was the Health and Human Services Division that requested it, but they didn't want to do the study internally because they didn't want to bias it. They wanted this outside group to do it. So UCSF did it with funding from the California Healthcare Foundation and from some grants. The idea being, I think, to collect a set of data and to come up with some initial recommendations so that then they can start doing, I think what folks here are saying is like, great, this is what we're going to do to tackle this population. This is what we're going to do to tackle this population. Like they said in this one, they identified like, hey, no one's paying attention to the fact there's so many folks out there who are pregnant and homeless. Why? Like, we need to make sure that that's something we're attending to. Hey, look, every time we ask the question separated by age, we realize the answers are different. You know, like the drugs they're using are different. The insurances they have are different. So we need to build, like you guys are saying, different programs, different subgroups. So I think the idea was, let's do a statewide survey, figure out what the differences are. They're also, again, I anticipate they're going to come up with a report that's going to show the geographic differences too, so that the state can then figure out, okay, if we're going to support this at the state level, instead of just giving each county or city $1 billion and saying run, you know, hey, can we actually have some focused measures that we actually want them to take based on what we're seeing out there? So that's my guess. But the group that studied it, I mean, they're academics. Their main idea was just we need to make sure we're producing like good data that you can rely on.
And then the
And
other
this
question.
group, by the way, is this group has been studying homelessness for a while at UCSF. They're really well practiced in this.
So
They have a
what
lot of
year-
really interesting studies they've done.
Well, how current?
This study was current, right?
What year?
Yeah, it was just published in June this year. So it was actually the surveys were done between, I think, November 2021 and October 2022, and they spent a few months gathering, compiling the data and then published it 6 months ago.
And where was the survey performed?
All through the state.
Yeah, throughout the whole California.
Most of
random.
it was all of California. Yeah, let me show you. I don't know where that one slide went, where I had the whole map and everything. It was great.
Yeah,
but,
it sounds like random selection.
But I have a more key question. Were these homeless people literally on the streets? Meaning, did they capture people living in their cars?
they did a mix.
People
Yeah.
couch surfing?
So but all of them. So they tried to capture everybody. They tried to capture sheltered, unsheltered, incarcerated, in hospitals, in different institutions. They had a whole list of everybody,
Right.
but they really tried, and they particularly tried to target some of these places where they know that it's hard to reach people too.
Right, because the surprise, we've discussed this before, but the surprise when Gramercy Housing was constructed,
Oh, yeah.
remember we put in, it was a big deal that they put in an underground parking lot, and it was going to be,
Right.
there's a lot of parking, but that the community would probably be able to use it because their people wouldn't have cars.
But
So
that's
that
a
was
myth.
5 years, well, things changed. That was 5-6 years ago. It took a long time to get the building built. So by the
Right.
time it got built, it turned out that the majority of the now formerly homeless seniors who moved in all had cars
Exactly.
because they were living in them. And it was their only possession.
That's
So
what I told them.
so they're
When we voted on
so they are parking, which is great. I mean, there's plenty of parking for
Right.
them, but they didn't have to give up their car to move into the building. But it did mean that Grace Conservatory can't use the parking lot when they have performances, events. Yeah, right, because it's
Oh, that was
the
part
parking
of
is
the
full.
plan.
That was part of the plan.
Mm.
But anyway, so I'm interested as
Yeah.
well in trending. I mean, in other words, do we have more or fewer people age 65 and older now homeless compared to whatever, a decade ago? And did this study even be able to ask that question?
This was, so they actually specifically addressed that point in their intro because that is an important question. This was the first study of its kind in like 30 years. There had been a survey like this done many years ago. That said, you have the point in time surveys like we're doing in January that are done in every city. And so
Right.
what they say is the point in time surveys can help us get a general kind of picture on a census, but it doesn't give us this detail of how and why. So this
No,
is
it
a how
can't.
and why study. And then they actually have a few points where the methodology they use is different than the point in time
Right.
survey. Like the way they ask the race question, for instance, is different than the way the point in time survey. So they say that they're like, please don't compare the two. These are
Right.
just two different surveys.
Right. Statistically, it's
Well, they're also asking for some self-assessment, and that's never
Yeah.
never
Exactly.
sent enough.
yeah, but
Yeah,
statistically,
exactly.
you can't do any comparison as far as trending is concerned because of the random selection. If we gonna do some
Yeah.
trending, we have to stick with our LA County, do some research on that, and then see
Yep.
over the last few years of the count how it has
Right.
elevated,
Right.
and it has it there by age category.
Right. And back to the point we were starting to talk about, it seems to me like, I don't know that billboards called 211 is realistic because billboards are expensive real estate.
Yeah.
But what about
The ads are all
bus?
over the metro, though.
Oh,
I'll
what
tell you, the
about-
ads are all over the metro.
Bus
Yeah.
sign, the side of
Right,
bus.
but,
Oh,
well, you're
stop.
saying bus, you're saying thing, but I'm saying bus stops. Maybe
Right.
the bus
Oh,
bench.
fair.
Bus
Bench
bench.
where they sleep.
Where they sleep, that's right.
Right, but that's not gonna help people who are living in cars or couch surfing. Well,
Well,
maybe the
cars drive by.
Put it
stop
on
and
the
bus
radio,
out.
put it on.
Anyway.
Just
Well,
think about.
I think this is the lesson, right? It's like no single solution. It's all of the above, right? It's the bus
Right.
stops and the metro stations and the this and the that.
Right.
You know?
Right, but
Right.
they put it in their.
Yeah,
But
they got
again,
the ones that go
I
there.
feel
They go
that
to the church and get
with too
food.
many of us talking at the same time.
Yeah. Go ahead.
Well, no, because the Zoom folks can't hear when we all.
I know, go ahead. Say what you're gonna say.
So it seems to me that one of the core issues that we can't resolve is the folks who are on the edge of becoming homeless, or who have been homeless, now they're not, but they're not really stable, stably housed. There's decision-making issues, there's just life issues that they have, and I don't know how we solve that.
Well, that's the prevention piece, and they finally come to terms that they have to focus on prevention as well as the other end as well.
Well, I mean, we've seen.
Otherwise, it'll never end.
You know, I mean, she's a landlord. I'm not really a landlord, but I work for a landlord.
Yeah.
And, you know, we see like seeking the perfect job. It's like, could you just get a job? Not the perfect job. You need a job if you want to have a place to live. You could work at McDonald's, it's a job, but it's not the perfect job. And obviously you can't work at McDonald's and rent a $3,000 a month apartment.
Exactly.
But you can work at McDonald's and rent in one of these co-housing. You could probably afford that. But you're not getting that kind of logical, if I do this, then this will help happen for me.
But that's where case management or somebody sits down and take the time to talk to them.
That'd be a younger population.
It doesn't matter. It doesn't matter because homelessness is all the way up to 80, 90.
No, I know. I mean, but there's these young people homeless. I think that's in many cases a more solvable problem. Only we're not working to solve it.
Yeah.
Needing a foster care system where you emancipate them and say bye and don't give them any money.
Some of them emancipate themselves. I have friends that don't, and those kids will leave.
Yeah. Yeah.
They just leave.
Yeah. So speaking of that, how many of you have already registered for the homeless count on January 25th?
Oh, are we switching to that screen?
Yeah, so if there's any more questions from Nuriel did a fantastic presentation. I love it. Lots of discussion and dialogue. But they count will you
Yeah, I'm trying to get there.
.org.
Yeah, can you guys see?
Have you registered?
Can you see the screen?
Yeah.
Put it up on your phone. Let's register.
Okay, so
They count will
here,
you
can you guys see?
.org
Okay, I'm sorry. For those of us who are
/Adams.
Okay, for those of you who are on Zoom, I can't tell if this is screen sharing or not. Can somebody answer, can you see the website?
Yes, can see it.
Excuse me. All
Okay,
of a sudden.
so it's theycountwillyou.org/Adams. And that takes you to the Holman Fit Geography and you can register there. They've upped the,
They put 8 o'clock. I want 6:30.
okay, but also what I'm trying to say is it was saying they need 75 volunteers. They have upped it to 100.
Yeah. How many do we have so far?
27.
Oh, we'll get there.
Yeah. And
28.
so this is where you register. I haven't done it yet. Sorry.
Yeah.
But
Well,
you
I'm
will.
not going out in the street anyway.
It doesn't
so
matter.
I'm
As long as
registered.
you can be handing out flashlights, you can do the
Well,
reception.
I'm gonna be there. I'm just not
Reception desk, have the
registering.
legal form signed, because I expect 100%.
I'm stopping the show.
January 25th is the last Thursday of next month, which is usually our meeting day,
Yeah.
which we'll have to figure out. Can we let our meeting day be the week before?
Yeah.
Okay,
Yeah.
let's let the city know ASAP.
Yeah.
Okay. And
Yeah, we haven't done the calendar for January yet.
right. And I'm gonna email you the invoice tomorrow, the $500.
Revised,
Yeah,
perfect.
revised. And the other young lady's probably gonna make some soup, but the council office will talk to them, see
Okay.
what kind of assistance they're gonna give. But it'll be great. This time it will be inside, not outside.
Okay.
Yeah, so the White Hall is back.
Okay,
back
I like the outside.
I did too. It was nice
It's
too.
nice.
It was.
But
I had to get the heater lamp, so I had to,
Yeah, it was
I was like, and then I had
But it
Somebody
wasn't
pick 'em up.
raining, it was fine.
Right, it worked out really nice.
Okay, so what we're talking about, Nuriel knows this, but again, we are being recorded. We don't know who's watching this on YouTube.
Right,
Is that UNNC is helping support the homeless count at the specific site on
Right.
Adams Boulevard
Yes.
in zip code 90018. The site is at Holman Church.
right.
By helping to support, it's not just that we're getting word out and finding volunteers, but we're putting in money to pay for chili
and rice and all
chili
the
and
fixings.
rice and the fixings. And we're saying gather at 6:30.
Yes,
Even though the site says 8 o'clock, because if you're gonna gather and have chili, you need to
Right.
have had your chili.
right.
Yeah.
Probably use the rest stuff before
Right.
you go out in your car.
And
Just
get
start
aside your
counting.
maps.
Yes, and get
Have
get all of
this,
that information,
right.
find your partners, because people come without necessarily their partners. Or come with three friends.
It doesn't matter, two is good.
Yeah,
Two is
but
good.
I mean,
'Cause they-
three people in a car is a good
Yes.
number.
But here's what I would like to ask, that everybody look at the training before that night. I'm not showing the video again like I used to.
Okay.
Yeah.
Yeah, so we can, if we have any questions, we can answer the questions.
How
But,
long is the training video?
not even 30 minutes, remember? I haven't.
No, I don't know.
was on
No, again, I
Oh,
haven't
yeah.
taken the training video.
Yeah,
because I stay at the site
yeah,
and
you're
don't go
not going
count.
out, it doesn't matter.
No, I'm not.
You registered just now?
It's not allowing me, but I'll do it at home.
Okay,
I promise.
okay.
Okay.
So theycountwillyou.org.
/Adams.
Yes.
Yeah. So that'll be great, and we will meet our goal. As usual, we usually surpass our goal,
Yes.
and we usually have more than enough. Last year, we had enough to go out one time. I couldn't believe it. Maybe I sent 2 teams out twice. But this year, I think we have less maps.
Okay.
I hope.
I don't know.
Yeah, the mayor's team sent out a group of people, the council
Oh.
team sent out people. So
Wow.
we had a good group.
Okay.
And they wanted to go out to have that experience the first time.
Oh.
Yeah, so it serves the purpose, we get it done.
Okay.
But I anticipate we'll be done by 11 or 11:30 this time. That's the goal.
And Muriel, thank you for the presentation.
Yeah, it was fantastic.
Yeah, it was really good.
Yes, it was really good.
It was
Yes.
fun. Yeah.
So are
Well,
you
it's a
coming
lot
out?
of work to extract that from a much larger study,
Yeah.
so thank you.
So any other what else we got over there?
No, we have nothing else on the agenda.
Okay, because Tori's about to, my
Die
eyes
over
are
there in
about
the
to have a
corner.
moment. I had Dr. Duriel, I had an allergic reaction last week that was more extensive than ever in my life. So it was like, but I got past it, but I'm still not totally 100%. But you can hear it in my voice. Oh, I knew I had some good news. I've been saying this for years. I did a project at LAC USC, and every day I was passing by this empty building. You know, remember the women's center that they had initially built for the women? It's been empty forever.
Oh.
So I got a call today before I came here that said they may be considering using it for housing.
Ooh, that's great.
Finally.
So the women's center, that used to be like a community club women's center.
No, that
It was always,
12 feet.
was it always housing?
No, it was a hospital.
Oh,
It was a hospital for women on the LAC USC, probably on the edge though. And so it's just in there. And what's happening is getting boarded up, the windows are getting broken. If you don't use something,
Yeah.
it's gonna cost more money to fix it up later.
Yeah. It's a hole in the ground now.
What? Is it?
They demolished it. Yeah, they demolished it. But what they're planning now to build on it, so right next to it is where they built the recuperative care village, which is an extremely low income, high mental illness, permanent supportive housing project right next to the hospital. And then right next to it, the women's hospital is capiche, it's dirt. But there's now a huge redevelopment plan to
Yes.
rebuild that area to be housing, take the old
Right.
general hospital that is seismically unsound after Northridge. They're going to try to refurbish that and maybe turn that into some housing community
Wow.
space. There's a whole bunch of other uses of that area that they're proposing too, including like a mixed use, like commercial area too.
Yeah.
So they're being pretty imaginative about how they want to do it. It's not like primarily to produce residences, but I think it's going to be an interesting project. It's going to take forever for sure. But the recuperative care village is up and running now. Cool place.
Oh, that's good news. Good news. They're both good
Yep.
news. So the consideration that's in the works is even better news.
Oh, that's great.
So that will make a major difference because that could be what? How many? 500 units?
Whoa.
It
I don't know.
It depends on how they develop it and design it.
Right.
Whoa.
Okay.
Well, it is
8:24.
8:24. Excuse me. Donna, did you have any questions or concerns? And caller, user, was that 2?
User 1.
User 1? I'm fuzzy, I'm telling you. Any questions, concerns, input? Okay.
8:25.
It's 8:25.
I'm seeing purses coming
And
out.
we're gonna officially adjourn.
Okay,
And I
Brian.
enjoyed every last minute of it.
Yes.
Especially since I didn't have to talk as much. But I look, have a happy holiday.
Yeah.
If I don't talk to everyone before then. And any questions on the count, get your friends together.
Yes.
They can be in separate cars, but let's get them